If you're over the age of 50 and you're waking up more than twice a night to pee, listen carefully. This isn't just annoying. It could be your body trying to tell you something. Many seniors accept nighttime urination, what doctors call nocturia, as just a normal part of aging, but the truth is it's not something you should ignore. In fact, it could signal a deeper health issue that's interfering with your sleep, your kidney function, your heart health, or even your hormonal balance. And in this video, we're going to break down exactly why it's happening, what you can do about it, and the surprising things you may not know that are making it worse. But first, let's ask a simple question. What causes you to urinate at night in the first place? Your body has an internal system that should suppress urine production at night. That's right, at night your kidneys are supposed to slow down, your bladder is supposed to hold more urine, and you should be able to sleep through 6 to 8 hours without needing to get up. So when that's not happening, there's a breakdown in the system. One of the most overlooked reasons is fluid imbalance and poor sodium regulation. As we age, our kidneys become less efficient at concentrating urine. This means more water is lost even when the body needs to conserve it. This change, combined with hormonal shifts, especially a decline in antidiuretic hormone, leads to more frequent urination, especially at night. Another major reason is poorly managed blood sugar. That's right. Even if you haven't been diagnosed with diabetes, high blood sugar can silently damage your nerves, especially those controlling the bladder. When that happens, the bladder doesn't empty completely during the day and more urine accumulates at night. This is common in pre-diabetics and type 2 diabetics, and many people have no idea their bladder issues are tied to insulin resistance. So if you're peeing more at night, it's time to check your fasting glucose levels or get an A1C test done. But let's not stop there. Let's talk about the heart. If your heart isn't pumping blood efficiently, fluid builds up in the legs and ankles during the day. Then, when you lie down at night, gravity shifts that fluid back into your circulation. Your kidneys detect the extra fluid and respond by producing more urine. This is called nocturnal polyuria, and it's very common in people with mild or undiagnosed heart issues. But that's not all. Medications can also play a big role. Diuretics, also known as water pills, are often prescribed for high blood pressure or fluid retention. But if you take them too late in the day, you're basically setting yourself up for multiple bathroom trips at night. The timing of medication matters, and most people aren't told this. Even common over-the-counter drugs like cold medications or certain sleep aids can impact bladder control or interfere with the signals between your brain and your urinary system. Then there's the prostate. For men over 50, an enlarged prostate is one of the most common causes of nighttime urination. As the prostate grows, it can partially block the urethra, making it harder to empty the bladder completely. That means you may feel like you have to pee often, even if your bladder isn't full. It's uncomfortable. It interrupts your sleep, and if left untreated, it can lead to more serious issues like urinary tract infections or kidney damage. And women, you're not off the hook. After menopause, falling estrogen levels weaken the pelvic floor muscles and can affect bladder control. This can lead to urgency, frequency, and the need to urinate more often at night. The muscles that support the bladder become less responsive, and without proper care, this can snowball into chronic nocturia. Now let's talk about another silent trigger, sleep apnea. Yes, a breathing disorder while you sleep can lead to frequent nighttime urination. When your body experiences low oxygen levels due to pauses in breathing, your heart releases a hormone called atrial natriuretic peptide. This hormone signals the kidneys to release more sodium and water, increasing urine output. So if you snore loudly, wake up gasping for air, or feel tired during the day despite getting enough hours of sleep, sleep apnea could be the hidden culprit behind your nightly bathroom trips. And what about your evening habits? Drinking too much fluid before bedtime is an obvious factor, but what's less obvious is the type of fluid. Caffeine and alcohol are diuretics, meaning they increase urine production. A glass of wine at dinner or an evening cup of coffee could be contributing to your sleepless nights. Even herbal teas, while healthy, can have diuretic effects, especially if they contain ingredients like dandelion or hibiscus. And if you're trying to hydrate late in the evening to make up for not drinking enough during the day, that's another mistake. Try front-loading your fluids earlier and tapering down in the evening to reduce nighttime urination. Now let's talk about solutions. If you're peeing more than twice a night, the first thing to do is track your patterns. When are you drinking fluids? What medications are you on? What time are you taking them? Keeping a log can help your doctor identify patterns and pinpoint potential causes. Second, ask your healthcare provider to evaluate your hormone levels. Low levels of antidiuretic hormone, testosterone in men, and estrogen in women can all play a role in nighttime urination. Simple hormone support or therapy may restore balance. Third, focus on your diet. Reducing sugar and processed carbs can dramatically improve blood sugar control and reduce nerve damage over time. Eating more potassium-rich foods like bananas, spinach, and sweet potatoes helps your body regulate fluid retention and supports heart health. Also, consider adding magnesium. This mineral helps relax bladder muscles and can reduce spasms that cause urgency. Many seniors are deficient in magnesium and don't realize that this simple fix could significantly reduce nighttime urination. Exercise is also a game changer. Regular movement improves circulation, strengthens pelvic muscles, and helps your body regulate fluid. For men, pelvic floor exercises, yes, Kegels, can improve bladder control and reduce prostate pressure. Women can benefit greatly from them too, especially after menopause. It only takes a few minutes a day, but the payoff is huge. And don't underestimate the power of better sleep hygiene. Elevating your legs in the afternoon for 30 minutes can help shift fluid before bedtime. Wearing compression socks during the day can prevent fluid buildup in the legs. Also, avoid screens and heavy meals before bed. A cooler, darker, quieter room can help you stay in deep sleep cycles longer and reduce those 3 a.m. bathroom visits. Finally, if you've done all this and you're still getting up multiple times a night, it's time for a comprehensive checkup. Kidney function, bladder health, cardiovascular risk, diabetes status, all need to be assessed. Don't assume that peeing at night is just aging. It's your body's alarm system, and the sooner you pay attention to it, the better your long-term health and quality of life will be. So remember, nocturia is common, but it's not normal. You don't have to live with it, whether it's hormonal imbalance, heart issues, nerve dysfunction, or even poor sleep habits. There's almost always something you can do to improve. And the sooner you take action, the sooner you'll sleep through the night, feel more rested, protect your organs, and enjoy life with better energy and clarity. Stay informed, stay proactive, and never ignore what your body is trying to tell you, especially when it's waking you up at night. Thanks for watching. Don't forget to subscribe Health/YouTube channel for more informative videos.